First of all, I'd like to thank everybody for coming here for this press conference that we've called today to really serve as an update. But before we get into it, I would like to thank our city manager, Ms. Rochelle Small-Toney, our city council members, city employees, emergency personnel, healthcare workers, and all other heroes in our city that work tirelessly to keep our residents safe and informed during these trying times. As you know, we had a meeting in March of 13th of this past year where we were talking about the COVID-19 update as it relates to the city of Rocky Mount. This press conference is designed to build upon that. And let me tell you, folks, this is real. COVID-19 is real. We're asking you to protect yourself, to maintain social distancing. You know, the COVID-19 virus has impacted me personally. I've had a cousin who passed away here in Nash County as recently as 2 days ago. And the impact that that has on a family, the impact that that has during that process is something that I really wouldn't wish on anyone. So my thoughts and prayers are with all those who are inflicted with the virus at the moment. And I would like to, at this point in time, give a little bit of direction. So we have pre-asked questions from the media so that we could maintain social distancing, so that we could keep less than 10 people in chambers here. And so what we're going to do is I'll call up individuals and they will then have the questions that have been asked for them and they will respond. So the first one that was asked of, I guess, me, why are salons ordered shut down but not beauty supply stores? The quite simple answer is what was defined as essential versus non-essential is defined by the federal government, later interpreted by the state government, and we're merely complying with those decrees. So at this point, I would like to invite our Edgecombe County Health Director, Ms. Karen LaChapelle, to provide an update as it relates to Edgecombe County.
Thank you, Mayor. I am Karen LaChapelle, the Public Health Director for Edgecombe County. And as I said the last press conference, case investigations are not new to public health. Our health departments, including all the health departments around us, nursing homes, hospitals, and other healthcare facilities, are well connected and working together to try and flatten this curve. As of 12 noon today, we had 18 cases in Edgecombe County. 3 of those are recovered, and sadly, we've had 1 death. In Edgecombe County, we are still seeing community spread as the biggest type of transmission. However, as expected, we have seen some close transmission from close contacts. The cases are spread throughout the county. Edgecombe County Health Department is asking everybody to be part of the solution to flattening this curve. Stay home and only leave for essential trips that you need to make, such as going to the pharmacy or the grocery store or just picking up supplies that you need to have. It is important that we all work together to reduce the transmission. And one of the things that has been new since the last time that we've talked about this is the CDC is now recommending face coverings. And with that, please make sure that you are not handling your face and while you're wearing a mask, and make sure you continue to wash your hands. And if you have a face covering, make sure you wash it often. Avoid close contact with sick people, and avoid touching your eyes, nose, and mouth. That's just so hard not to do during the day. Stay at home if you're sick. Cover your mouth when you sneeze or cough with a tissue. Disinfect your office and areas that are common real often during the day. And if wash your hands at least for 20 seconds. And if you can't do that, which I know that the hand sanitizer's been in a short supply, try to, if you have some of that, use that. And make sure it's at least 60% alcohol. And one of the most important things that I think is practice social distancing. Avoid handshakes, hugs, fist bumps, and other types of contacts. One of the things we've done in Edgecombe County, as of March 30th, our health department began providing limited services due to the COVID-19 outbreak. Current services that we're providing by appointments is symptomatic STDs, maternity clinic, problematic family planning, and birth control methods pickup. You can get your birth control. Dental emergencies, we are providing that by appointment. And HealthWorks, which is our alcohol and drug testing program for employers. Our CAP services, which is Community Alternative Programs. It's a Medicaid program. We're providing our social work management programs, and WIC is open, and it's mostly done by the telephone, except if you need a breast pump, if you're a breastfeeding new mom. Environmental health is handling most of their services through the phone, but we'll go out if needed. And our school nurses are working with us to help with documenting and covering the mandated requirements of the Public Health Department during this time. So I did get, and if you have any questions or concerns about Department of Social Services, Betty Battle is the person to contact. Her number is 641-7611. And our county has also closed our county buildings to the public, but you can still access the services by calling. We also have drop boxes that are designated for the buildings. And on each building the phone numbers are listed to what to the program that you need. And I did get one question: why are manufacturers requiring shoulder-to-shoulder work despite positive tests from coworkers? Well, what we have been recommending industries to do during this time is to use the CDC guidelines, which does not allow that. And if that's a problem, you should call your local health department. Thank you.
Thank you, Ms. LaChapelle. This time I'll ask Mr. Bill Hill, who's the Nash County Director of Health.
Thank you, Mr. Mayor. I'm Bill Hill, Health Director of Nash County, and many of the things that Karen LaChapelle just said, I won't repeat, but they're excellent types of advice to give that you've all heard about, those universal precautionary measures to take, which we've called public health measures for years. I will talk, since she's covered those areas, I'll talk a little more specifically to the cases in Nash County. We have had 27 cases. We just received 2 overnight, 2 new cases that put us at 27. Geographically, obviously I won't specifically talk about that for identifying reasons, but I think you might be interested to know that 48% are right here in the city of Rocky Mount. That's about 13 of the 27. The racial mix would be somewhere in the neighborhood of 7 Hispanic, 9 African American, and 11 white. The recoveries that I'm proud to announce are at 5 or 6, have just about completely recovered with relatively mild cases. We do have 6 hospitalized as I speak still, and certainly that would be in a local hospital and our surrounding hospitals. We do have several that are sick at home that are maintaining their illness in a home environment. You probably did hear, many of you, Code Red. Notice we put out last night, that was out of our EMS section. We thought it was necessary to again remind our people at home and that are staying at home or trying to get out a little bit to continue to stay at home when they can. Only go out for essential visits when possible. This Code Red announcement was saying that this is nowhere over. I know we've read and heard about the peak coming soon, maybe as soon as mid-April. I'm sort of doubtful that we'll see that peak come that soon, but I will say that North Carolina and our surrounding counties, including Nash County, city of Rocky Mount, have done extremely well, and I just send a lot of kudos out to the citizens in our area, that have really adhered to all these safeguards and public health measures they needed to take. You see it all the time, and I know you have witnessed some violations, observed some of those, but by and large, our citizens have adhered to these public health safeguards that we put in place. We obviously are having a lot of citizens to call with different concerns. I was asking our nurses this morning, what would you say a primary concern might have been other than contracting the illness, the virus itself? And it's been the typical one is someone was sent home sick, possibly with coronavirus, and what do we do now? So obviously that is a big part of public health practice when you have a confirmed case, to make sure that we follow up on what we call trace contacting the best we can, or trace contacts. There we are involved with not only household contacts, but work environment contacts, and those that are less close to that person, but certainly still contacts enough to get in. We are still testing every day in a drive-through like testing site behind the health department. We did 5 today. We keep a number of pending with the state lab. The turnaround has been close to 24 hours, but sometimes 48 hours before we get a turnaround to receive that particular test result. I will say, as of this morning, in Nash County, from the hospital and private providers and health department, been 389 tests done, conducted, of which in Nash County, 27 cases. So about 90, probably 2 or 3% have been negative. 7% of those have been positive. That's a slight increase from last week. We were running about a 5% positive rate, and now we're at 7%, but relatively low on the number of ones that we've tested. I do predict that will go up somewhat as sicker people come to us with that are symptomatic and have been in direct contact with confirmed cases. I'll be glad to answer a question or two if there are any, or we'll just go with that's my report. And if it's, I would say this: we are doing these daily teleconferences that are really orchestrated or narrated through the county manager's office. We're doing them 7 days a week, 11 o'clock every day, which I know the mayor participates in. We'll certainly continue Good Friday tomorrow and Saturdays as we've gone through the weekend, and then the one on Sunday is at 2 o'clock. So we have tried our best. We must have at least 40, 45 participants in those teleconference communication venues that we are producing.
Thank you.
Thank you.
Thank you, Mr. Hill. And this time I'd like to hear from Dr. Tisa Roberts.
Hello and good afternoon, everybody. I am here to talk to you a little bit about what OIC, that's Opportunities Industrialization Center, is doing. We are a federally qualified health center located in Rocky Mount, and we're taking care of patients from the Nash and Edgecombe communities. We are continuing actually to take some walk-in patients. We have many patients that we serve that do not have access to phone, they don't have access to internet, and they might not even have access to transportation, so they walk. So we are still trying to make sure that we are able to take care of every patient that we serve. We have our temperature checks. We're asking questions before you come in for your visit. We're making sure that our lobbies are socially distanced, or we have most of our chairs 6 feet apart. If we can't break them up, we have you with the do not sit in that particular area. As providers, we are trying to move as many visits as possible to either telehealth visits, or we're also trying to move as many visits to maybe even a car visit. Whatever we can do to keep all of our patients safe, to keep our staff safe. We want to be here to take care of the community, and we want to make sure we have providers to take care of the community as well. We are using our local hospital's respiratory disease center, and I'm forever grateful that they have come up with that to do our testing. And if you're sick, we're trying to keep you at home so we can keep everybody safe. So OIC, in addition to having clinics, we also are a resource for the community, for jobs, education, training, etc. Our staff is working from home, and we're continuing to work with our patrons and our constituents, and we're trying to make sure that they continue to have what they need during this difficult time. I like to say we're of the people, by the people, for the people, and we're and for the community. So OIC is here. We're your community resource. We have not shut down, and we're doing everything we can to keep you healthy during this time. I was asked one question from the media, and that question was, can a senior with a compromised immune system walk in their neighborhood? Remember, the CDC guidelines are now recommending that you wear a mask at all times, and we are encouraging people to continue to get their exercise. You want to make sure, without a doubt, that you are practicing social distancing. If you have any questions whatsoever about what you should and should not be doing, you should absolutely call your primary care's office and make sure you talk to your primary care doctor, because they're here to keep you safe. That ends my report for OIC. Thank you for your time, and if there's any questions, I'll be happy to answer.
We were pre-doing the questions, so thank you very much,
All
Dr.
right,
Roberts.
thank you.
Thank you, Dr. Roberts. And this time I'll ask Dr. Lee Isley, who is the president and CEO of Nash UNC Healthcare.
Thank you, Mayor, City Council. Good afternoon. I want to first thank the health departments and all the agencies that we have been working with locally and throughout the state. We've been working very closely with our local health departments, the state health department, UNC Health's infectious disease experts, and the CDC throughout this process. And these partnerships have been invaluable to your health system as we prepare for this crisis and taking care of our communities. Consistent with the health department's reports, our hospital has seen a steady increase in cases in the last week. We currently have 6 COVID positive inpatients in our hospital and 6 COVID pending inpatients in the hospital. The COVID pending means that we are waiting for their test results to come back. These patients all require medical attention. We have seen and treated many other patients in which we have been able to successfully discharge to their homes and their primary care physicians and interactions with their health department to self-quarantine while they maneuver through their disease. We have also safely discharged 2 of our inpatients that were COVID positive back to self-quarantine in their house for the rest of their treatment to be worked out with the health department and their local primary care physician. The other that we want you to know, that the Board of Commissioners want you to know, is that your hospital is prepared. We have a local task force working around the clock to prepare for the various stages of this outbreak and to ensure the safety of our patients, staff, and the community. We have specific plans to place COVID-19 patients in specially prepared rooms designated to treat communicable diseases and to limit exposure to the staff and keep other patients safe. We're already utilizing dedicated wards for the COVID pending and COVID positive patients and are continuing to expand those areas as we go through our planning and preparation process. We do have visitor restrictions and screening in place at all entry points in order to protect our patients, our staff, visitors in the community, and you can find the details of those restrictions and entry points on our website at nashunchealthcare.org. As you probably know, our staff and medical staff have servants' hearts and are in healthcare because they love to help people. Through this situation, can cause fear and anxiety. Our staff are ready to do what we need to be done to serve our community. We thank you for your efforts, and as you make preparation and as you remember social distance and you help to stop spread the virus. We thank you for your support, and together we are stronger. I received a question related to can anyone receive a test for COVID, and that's a long answer. I'll try to answer in a few words. You really need to work with the health department and your primary care physician. The CDC have recommendations on who qualifies for a test, and so quite simply, you can't just ask for a test if you don't meet the qualifications, but your primary care physician, provider, or the health department can help you navigate through who qualifies for those tests, where those tests are administered, and how you can have access if you do qualify for a COVID testing situation. Mayor, thank you very much.
Thank you, Dr. Isley. This time I'd like to ask our Fire Chief, Cory Mercer, to the stand.
Thank you, Mr. Mayor, members of the council. Good afternoon. I'm Cory Mercer, Fire Chief for the City of Rocky Mount Fire Department. The mission of the City of Rocky Mount Fire Department is to serve all the citizens by saving lives and protecting property through quality and excellent services. During this recent pandemic of COVID-19, our department has continued that mission in a professional and safe manner. Our efforts have been both proactive and reactive to ensure that our citizens to receive the same level of service prior to this epidemic affecting our community. Since the onset of this virus, the department has temporarily suspended smoke alarm installations, car seat installations, station tours, and non-essential station visitors. In being proactive, we have also altered the call-taking criteria for our 911 dispatchers. EMS calls that are COVID-19 related will be emergency medically dispatched with some follow-up questions. Some questions that you can be expected to be asked are you experiencing any flu-like symptoms? Are you experiencing a high fever? And have you traveled outside the community? Also, when personnel arrive, they will be in the proper protective equipment, which will consist of a mask and a glove, so please do not be alarmed. Personnel may also ask you to exit the structure, and while maintaining social distancing, they will then perform the initial patient assessment. All citizens are asked to follow all CDC guidelines for preventive measures against this virus. Please continue to practice good personal hygiene measures of washing your hands and cleaning your shoes when going outside. Sanitize common areas and always practice social distance. Pay special attention to your diet and build up your immune system. The best practice is to shelter in place and stay at home. Overall, there has been a decrease in calls for service since we have adhered to the governor's order. If we continue these best practices, I am confident that we will get through this pandemic together. Thank you.
Thank you, Chief. This time I'd like to ask Chief George Roberson, our police chief here in Rocky Mount.
Thank you, Mayor and Council, for having me here. Good afternoon. I'm the Police Chief of Rocky Mount, George Roberson. The Rocky Mount Police Department is committed to the safety and well-being of our citizens as well as our employees. In light of the continuing concerns as it relates to the coronavirus outbreak across our state, the Rocky Mount Police Department is working hard every day to ensure that members of our community are protected and safe as we try to reduce the spread of COVID-19. To assist us in this venture, we have initiated new protocols at the police department. Some of those protocols are related to calls for service. Reports that can be taken by phone will be taken by phone. An example of those reports are larcenies, shoplifters where there's no suspects in custody. Where there are suspects in custody, we will respond as usual. To get more information on services that have been altered, please go to our Rocky Mount Police Department Facebook page and you can get a full detail of those services. In incidents where we must respond to homes, please understand that our officers are practicing social distancing as related to the CDC guidelines. So if they ask you to step outside, please do not hesitate and just comply. They're not only protecting you, but they're protecting the community and themselves. When transporting prisoners and persons in our patrol vehicles, our officers are encouraged to disinfect those vehicles at the beginning of duty, during their tour, and at the end of their tour. If a vehicle is a shared vehicle, our officers will share those same responsibility, which is to disinfect the vehicle after every use. Keeping everyone safe is the top priority of the Rocky Mount Police Department. For clarification, I receive a lot of comments and questions about a curfew. There is no curfew in the city of Rocky Mount. However, a stay-at-home order is in effect per the governor. Gatherings should be limited to 10 people or less. Citations can be issued and arrests can be made. However, thus far, our citizens are voluntarily complying, and that's what we're pushing for, compliance, not citing or arresting anyone. Overall, there has been a decrease in calls for service. I thank our citizens for that. You're not only keeping us safe, but you're keeping yourself safe. It's going to take all of us to get through this pandemic. The Rocky Mount Police Department will enforce restrictions found in the governor's order. For those of you are not familiar with where the governor order is located, go to governor.nc.gov, and it should list what those obligations and those governor's orders are. To business owners as chief of police, please run your business responsibly. Patriots, please abide by those required sanctions issued by the governor. The Rocky Mount Police Department encourages all members of our community to take personal responsibility in following the recommendations of the CDC, the mayor, and the governor. Let's keep Rocky Mount safe and healthy. I have received 2 questions from the media. One, where can you report companies not following the rules? 252-972 is the police dispatch and communication center. They will dispatch an officer to that location, and he or she will see if that the governor's order is actually being violated. Question number 2, can we take down basketball goals so people won't play? As of now, our citizens are complying. There have been a couple of incidents where there have been citizens playing basketball, and everyone has complied when requested. As I said, we seek compliance. Thank you.
Thank you, Chief, and thank you for going over those statistics. Curfew has been one of the things that I've been asked the most on a consistent basis. Why haven't we declared it, specifically me? And the answer is, I think that as a general rule, we are complying with the current rules that are in place, and I believe it's an unnecessary thing. So with that, I would like to invite our city manager up, Rochelle Small-Toney, who can give us a tremendous amount of depth and information about how the city is running. And I want to thank you again and your team for all that they've been doing.
Good afternoon, Mr. Mayor, members of council, and all that are watching. As a result of the implementation of our continuity of operation plan a couple of weeks ago, on any given day, the city staff is operating between 60 to 75% of capacity as a result of the stay-at-home and social distancing orders. This means that we have reduced the number of city employees in offices, on crews, and out in the field, while striving to maintain the highest level of our municipal service delivery under these circumstances. Again, on any given day, the city workforce is operating between 60 to 75% of its normal capacity. Even with services that we deem to be essential, there are reductions in staffing just to abide by the social distancing requirements. As a result of this, there will be delays, but we are committed to doing all that we can to keep our employees safe and healthy, and we all appreciate your understanding and patience. Our citizens have done a wonderful job of staying connected during this pandemic. Staff has put an emphasis on sharing information regarding the excellent municipal services we provide on our website and various social media platforms. As a result, the Our City at Work campaign, which highlights city staff continuing its daily responsibilities, has gained a tremendous following on the city's Facebook, Twitter, and Instagram platforms. Since the Our City at Work campaign launched March 23rd, more than 45,000 people have been reached on those platforms. We've even seen residents post their own pictures during this period, thanking our departments. Residents are encouraged to share their pictures and tag us on the various platforms by using the hashtag OurCityAtWork and hashtag Rocky Mount. This week, we have also launched on our website our Citizens Resource Center, which is a one-stop for information related to the COVID-19 crisis. The website links citizens to information from the federal, state, and nonprofit services and is kept up to date with new information. Concerning the residential yard waste and bulk items, environmental services and streets divisions are working with reduced staff, working in 2 teams, alternating weeks to maximize employee safety and protect operations. With these staffing levels, residential garbage and recycling pickup will remain on a normal schedule. However, bulk and yard waste, including loose leaf collection, will take longer to collect. Residents are asked to place yard and bulk waste, including tree limbs, at the curb as normal. City staff will collect yard and bulk waste items as close to the normal collection day as possible. I'd like to personally take this time to thank our dedicated employees who have stepped up to the plate during this pandemic and provided the services our citizens deserve. I would also again like to thank our citizens for your patience. I have been given 4 questions, some of which I think I have answered. One, of course, is debris going to be picked up? Yes, it is going to be picked up. However, as I mentioned before, our operations now are down between 60 to 75% of capacity, so you can expect delays. Again, another question, what will be done about curbside trash? Here I'd like to just emphasize that for us, our highest priority in residential collections, of course, is the residential trash collection. I shudder to think what the community would look like, the health problems that would result if we didn't place such a high emphasis on collecting the residential garbage. And so that is our highest priority, of course, followed by the yard collection as well as the bulk items. The third question is, can the city spray anything at night to diminish germs like they did for mosquitoes? This question is coming from someone that's about my age, because I remember when cities used to spray this lethal gas, if you will, to kill the mosquitoes. So the answer to this question, we have not thought about spraying anything in the community. Not sure that anything sprayed in the community would be environmentally safe or even would attack this particular virus. So we'll set that question aside. Are city leaders planning or have made sure employees are equipped with PPEs? Actually, the executive leadership team and I had this discussion this morning, and thankfully the fire department has been able to access additional masks and PPEs for the city staff, so you'll start to see even more staff, particularly out in the field and in the offices, wearing masks. So with that, Mr. Mayor, I'll turn that back over to you, sir.
I'll take that. Thank you. And the green. Sorry.
Thank you.
Thank you, City Manager, for all that you're doing. Thank you for your team, for the work that you're putting on. I want everybody to know out there that we're receiving calls on a consistent basis from Facebook Live and other mediums that we can't really process to answer at this point in time. But please check our website for the City of Rocky Mount, and we'll be responding to each and every one of these questions as we can. And so I'd like to acknowledge our City Council that are participating versus MS Team, but also those that are present with us. We have Andre Knight, Council Member and Mayor Pro Tem, Richard Joyner, Councilman Richard Joyner, and Councilman W.B. Bullock. And I don't know if any of you gentlemen have anything that you might like to add to the conference today.
My concern, Mayor and Council, that as I travel throughout the city, my heart is saddened because when you go into certain convenience stores, grocery stores, that are heavily located in African American communities, gas station, even our post office, drive-through restaurants, especially fast food, and some manufacturing industries. They are not practicing this CDC regulation. I just left out of one of the dollar stores, and they didn't have the petition up. Neither did the employees have a mask on, a face covering, or gloves. And I asked the question, they said we're not allowed to wear them. Wherever I see this throughout our city, I ask that question. They say they're not allowed to wear, or we don't have it. If we're going to have our businesses operating in our city, and Nash County Health Director just mentioned about code red, or the red code, that we must stress, I don't know if we can pass an ordinance, that if we're going to do business, for those citizens or employees on the front line that are servicing our community, our constituents, that they equip them to do the service. Most of these employees are single mothers, females that have to go home to their children, their grandparents, and they could be exposed to the virus and then transpose that to other family members. So it's very concerned that I see here in Rocky Mount, and I don't know what we can do as a governing body to make sure that if these businesses operate throughout our city, that they are following the CDC regulation and also the executive order of our governor and the executive order that our mayor, that we adopted as a council and as the mayor. So I hope that we can put some teeth in this enforcement, because it's very devastating as we continue to try to curb this peak. I see that we're going to be hit pretty hard if we don't follow these regulations. Thank you.
I absolutely echo those same sentiments. This is no joke. This is not a drill. This is a real thing, and we need to use judgment. We need to maintain social discipline, separation. We need to absolutely wash our hands on a consistent basis. And if you are working on a frontline basis, let's start with calling 211, which is the governor's information line that may be able to connect you with some items of that nature. Try with health departments, communicate with us. I don't know that we have the answers, but I think we're all committed here to trying to find as many answers as we possibly can for everybody, because every single infection is a big deal and a significant issue for the entirety of our community. And so with that said, again, I'd like to end on a positive note that, this is a time of crisis. This is a time of unity, I believe, and that this is a point in time that we need to continue to consider the CDC. We beat that home over and over and over. But I'd like to go over a couple other announcements that I think that just are important to communicate. First of all, the Nash Rocky Mount Schools and Edgecombe County Schools are providing free daily meals to all children in the area. These sites and hours are updated weekly, but the service will continue as usual. And now, locate these sources for your family. Please text Food NC to 877-877. Again, that's Food NC, FOODNC, or you can call 211. That's a number that's available to all North Carolinians to also connect needs with resources that we have. Finally, if you are exhibiting any kind of symptoms of the coronavirus or COVID-19, that looks like fever, cough, shortness of breath, please call your health provider. You've heard from a number of our officials here today. It is significant. It is critical that we self-isolate as needed. It is critical that we understand that the virus will spread very quickly, and it is something that we really, really don't want you or your family to have to experience. Now, if you're not feeling well, you don't have insurance, that's a critical component for a large segment of our population here in Rocky Mount, as well as in the country. You need to call your local federally qualified health center. In the city of Rocky Mount, that is the Carolinas Family Health Center. Call 252-641 0514, or visit them online at cfhcnc.org. That again is cfhcnc.org. And I believe the OIC may also qualify as a federal qualified health center. I'm not positive about that, but you may want to check on that as well. Yes. So I'm encouraging all of you to stay updated with reliable government websites and resources. Check our website at RockyMountainNC.gov. Visit our resource center at the top of the homepage. And then you can also see updates on my Facebook page, and I'm sure all of those on council as well. So please, please, please stay informed, be safe, be well, and thank you so much